How's the sound on everybody's computer? I hear some breaking up of some connections. I think this is we're just gonna have to deal with being that we're on internet connection to make it skips.
Okay, it's live. Gonna get on the page to double check.
Okay, I will call the meeting to order. Lucinda?
Good afternoon, everyone. Notice of a special emergency meeting of the City Commission of the City of Brownsville, teleconference open meeting. Pursuant to Chapter 551, Title 5, Section 551.041, of the Texas Government Code, Texas Open Meeting Act, notice is hereby given that the City Commission of the City of Brownsville will conduct a special emergency meeting on Tuesday, March 24th, 2020 at 5 p.m. via Zoom teleconference meeting by logging on at https://zoom.us/a/658-433-003. Meeting ID number is 658-433-003.
Okay, we're gonna skip the invocation and the pledge if everybody's okay with that. If anybody would like to have those items, we can certainly do that. President, you said that?
At this time, I would like to, the first item on the agenda is the public comment period. For the record, I did receive the following public comment forms, but they do not wish to address the commission and their needs are Teresa Aguilar, Stephanie Dominguez, and Alonso Saldana. We'll continue on to the next agenda item, which is agenda item number 1. Consideration and action to approve the city manager to authorize purchases above the formal solicitation threshold in response to COVID-19.
Good afternoon, Commissioners. This is Lupe Granado, Finance Director for the City of Brownsville. The City of Brownsville must obtain City Commission approval for contracts with a value above $35,000 through the formal solicitation process. Texas Local Government Code allows municipalities to invoke emergency procurements as per Section 252.022 General Exemptions. In response to COVID-19 pandemic, the city staff recommends authorizing the city manager the ability to approve contract services above $35,000 under the local government code mentioned on general provisions exemptions for COVID-19 related expenditures.
This is an action. Is there going to be any other presentation on this?
No, sir.
Okay, do you have any motions?
I'll make the motion to approve.
Second.
I think we need some discussion.
Do we have a presentation I know we have a motion and a second. Let's discuss the item. Somebody want to discuss?
I think Commissioner Neese was trying to say something, but his voice is breaking up.
Okay.
And if not, then I would just like to know though, is there a ceiling? We can't? I have everyone's well-being in mind, but at the same time, I don't think that we can just not put any caps on how much spending. Like I don't mind saying, okay, within the next week, you're authorized to go up to $200,000, or I don't know, but I can't just see not putting a limit.
Mr. Bernal?
I think certainly not. That's the commission's, certainly the commission's discretion. At this point, we're about a week into this pandemic, at least locally, and this is providing us flexibility. I know there's going to be a commission meeting on the 7th of April. That should remain as scheduled. If the commission wants to have some type of
that
can be re-examined at that point, that's very doable. It's very difficult to provide information in terms of the types of costs that we're seeing. We can share some of our experiences with trying to get personal protective equipment and things of that sort, trying to get testing started, but some of these costs are still very, very fluid and unknown. This is to give us flexibility at this point where we are.
I have a question. So, go ahead, Commissioner. Go ahead.
Noel, do you have a suggestion for us?
So just to give you all a rough order, so for the immigrant influx over a 12-month period, and Lupe, help me out here, but I believe we exceeded $250,000 over the first 6 months, if I'm not mistaken, Lupe?
That's a correct amount, sir.
Okay, so, and this is very different. I'm just trying to give ourselves a point of reference from just last year. That's how long we were able to go with 250. That wouldn't be a bad number to start, assuming that there's some type of correlation to the immigrant influx. It might give us some latitude. I would think that 250 would give us some latitude between now and April 7th, where we'll know a lot more.
That's fair. Commissioner Munguia, you have?
Yes, and just to confirm, so if this happens within, you go over the 250 within a week, do we have to have another emergency meeting so that you can be able to provide the sorely needed assistance to the citizens of Brownsville?
You would not. Oh, I'm sorry. If you give us a ceiling, then yes,
Correct.
yes, we would. We would be limited to that amount between now and the next meeting date, when you all would be able to increase that amount.
My only concern is from the beginning, every day that passes by, we have different information or different standards from the CDC. And very quickly in other cities, we have seen it escalate through the roof in 3 or 4 days. And my only concern, of course, is money being spent correctly. But this is a life or death situation. And I just don't want to tie my hands up or put myself in a situation where we need to order beds or we need to order some type of materials or things like this, and we have a low ceiling. I would like to see a number that I would feel comfortable that if we were to see numbers skyrocket in our city, that everybody would be taken care of as soon as possible, and we wouldn't have to post a meeting and have these 24 hours. I don't foresee it happening, but it could happen based on what we've seen in other cities, and that's my only concern.
What? Got a question and input. This would be on a per contract basis. This wouldn't mean the amount, the ceiling to spend on this COVID-19 activities. We're talking about if there's any particular procurement, whether procurement of supplies, procurement of or contract services. This would be on an individual contract basis, not the total.
Okay.
That's what I wanted to be.
Enter your participant
I
ID.
just wanted to
You are in the meeting now. There are more than 50 participants in the meeting. This meeting is being recorded.
I'm sorry.
Okay, so I thought I wanted to raise the savings cap from 35. Can you all hear me?
Whoever's speaking.
Tom's teacher. Sorry.
Mr. Bernal, do you have any input as to what some of these items being discussed or the spending limits? Is it your anticipation that some of these items will be reimbursed in some manner?
We're not aware that FEMA did release a fact sheet on public assistance and what is reimbursable and what is not reimbursable. At this time, we would need to review some of that. I'm looking at some of those memos right now, but there isn't a lot of information as of today.
Well, there were different guidelines and topics as to what general things were reimbursable. Did you look at that?
What we found, for example, for the immigrant influx, we weren't aware of what was reimbursable until months down the road. What we ended up doing and what we started doing in this situation also, as a lesson learned, is we're tracking a lot of costs already. So we're tracking some sick leave issues, we're tracking certain expenditures, we've coded it to COVID-19 just to be proactive. But some of the information on reimbursements, I think Congress is trying to pass a stimulus bill as we speak. Some of that may be for public assistance. It's just very preliminary to have a good sense of what's reimbursable.
Okay. Well, I had a motion and a second, but we're still in discussion. Any other discussion?
And I have one more question. So, Mr. Bernal, you don't anticipate having another meeting next week, at least to, keep the public informed of what's going on?
A special meeting or a,
Well, it would have to be a special meeting because the regular meeting's not scheduled until April.
yeah, that would be up to the commission. We can do that. If that's the request, we can do that.
I mean, to a certain extent, I would like to at least be out in the open, engaging with the public, at least in a form like this, at least once a week, especially during a situation like that. If this technology works out, then I don't see why we shouldn't be at least having a meeting once a week.
It's something we can do next week. I think at very least an update is sufficient. Let's kind of play that by ear, but I don't see a problem with that at this point.
Do you want us to amend the motion with the ceiling, or I'm fine with or without the ceiling for a week without problem.
Well, and then in terms of legal, shouldn't there be a ceiling? The motion has to be pretty specific. It's too vague, or I'd like an opinion from the city attorney about that. If it's just,
I agree that it's very, very broad, and if you are interested in having parameters, you can make a floor amendment at this time to include a ceiling. My understanding when this item was originally presented to my office was that they were increasing the threshold, not necessarily by volume or amount, but by the original threshold that the city manager had of 35,000 before having to bring something to the commission. I'm not sure if that's still the intent, because if it is, I believe that's what maybe Lupe was trying to allude to, that they were trying to increase the amounts that could be processed by the city manager from 35,000 to 50 before having the item have to be brought back to the commission. So I think this is an opportunity for the commission to be clear about what it is that it's authorizing the city manager to be able to either or by amount or by transaction. Because I think that's what Lupe was getting to. Lupe?
so the current motion on the floor is?
The current floor is as stated in the actual agenda, which is to approve the city manager to authorize purchases above the formal threshold. There's so, Commissioner Tetra, was it you that made the motion?
I made the motion. I can withdraw or I can amend. It's up to the.
Commissioner Gowan, I believe, was the second. If you wish to amend your motion, Commissioner, you can. Based on Mr. Granalo's representation, this is a per contract amount, so if you wish to amend your motion, you can do so.
It's up to the commission. I mean,
I don't see that threshold based on.
Can you all hear me?
I'm sorry, Mayor. What did you say?
I don't see an issue with the threshold that Commissioner Galansky recommended, especially considering Mr. Granal's representation, it's a per contract basis.
Okay, I'll make the motion to amend to include a ceiling of $250,000 per contract.
We have a
I
motion.
second that. I second that.
We have a motion to cap as stated 250, and a second. Any further discussion? Those in favor?
Aye.
I'm gonna vote against.
Who's voting against? Commissioner
I'm
Galansky?
gonna vote
Yes.
on that.
Okay, motion passes.
And just to let the public know that if we have to change that, we will come back immediately and do so for the sake of the public and their safety.
May I have a roll call, Mayor? It wasn't clear to me how the vote went on this one.
Because of the technology, will everybody who's an aye, please raise your hand at this time? Okay, we have 1, 2, 3, 4, 5 ayes. Anybody that's a nay, please raise your hand. Commissioner Neese, I cannot see Commissioner Gallant. Oh, there you are. Okay, so that's 5 to 2. Motion passes. Thank you. Next item.
Next item is consideration and action to approve city manager to delegate authority to the deputy assistant city manager or emergency management coordinator for approval of purchases above the formal state decision threshold in response to COVID-19.
I would move to allow the city manager to delegate the responsibility to make expenditures related to COVID-19 to the deputy city manager, to the assistant city manager, and the emergency management coordinator, but each expenditure should be no more than $50,000, those that are delegated.
We have a motion, do I have a second?
I'll second that.
We have a motion and a second, any further discussion? Those in favor?
Aye.
Aye. Those opposed?
Nay.
One opposition, Commissioner Cowan? Okay, motion passes. Next item?
Item number 3, consideration and action to approve resolution number 2020-028, expanding the scope of services of the Public Health Department.
Good evening, Honorable Mayor and Commissioners. Our department thus far has been providing services to the community, functioning as an environmental health department. And environmental health department, I mean like ordinance enforcement, code enforcement, and health inspections. Given that we're facing the COVID 2019, this item tonight, if authorized under the Texas Health and Safety Code, Title II, Subtitle F, Chapter 121, Section 121.003, also known as the Local Public Health Reorganization Act, allows municipalities and other local governments to create health departments and empower them with the task of making necessary improvements and provide services to promote the public health. Subject to availability of funds, the department may provide essential health services for any underserved segment of the municipality. These services include but are not limited to identifying community disease, and the word we use there is epidemiology, and surveillance, which is close observation, especially of suspected viruses. The health department is also tasked with informing, educating, and empowering the community with respect to these health issues. The department is also called with the duty to work together with other local, state, and federal agencies to engage and mobilize community partnerships in identifying and solving community health problems, as well as developing policies and plans that support community efforts to improve health. What I'm translating that to is it puts us in a position where we can more effectively communicate with our peers and our colleagues within health departments and exchange information across the board. Previously, we've never had a condition of COVID where CDC is releasing almost sometimes daily update 2-3 times per day. And this puts us in a situation where we're always running and trying to catch up to the information that's being put out. This resolution will allow us to use our epidemiology and our surveillance tools at our disposal to try and get ahead of what we call clusters or hotspots in other languages. I am open to questions. I also asked Dr. McCormick to join. If any questions, I'm not sure if he was able to join us tonight.
I do see
this resolution allows for this. Yes, sir.
I do see Dr. McCormick there. Dr. McCormick, you're unmuted, so go ahead, sir.
Yes, I just want to support what Dr. Rodriguez is saying, that first of all, the importance of this move to create for people to stay in place is highly important. I think we can all see the consequences of not doing that. We can see it in the early days in China. We can see it in Spain and Italy. And so I applaud the efforts here to get ahead of this curve. And indeed, we can see what's happening in New York and Washington. So this is a really important move. What Dr. Rodriguez is proposing is a way to allow us to start to identify cases of infection or even suspected cases if we don't have sufficient methods of testing, and to be able to track those cases and the area around it for potential new cases, to provide education and increased surveillance in those areas. We did this in Cameron County with the H1N1 outbreak in 2009, and it was highly effective. We were able to communicate with people in specific areas where we saw the hot spots, and to help them understand the importance of, at that time, of not going to unnecessarily to clinics and hospitals because that would spread the H1N1 even more. This is a much more infectious disease, and it's more lethal than the H1N1 ever was. So I applaud this effort, and we at the School of Public Health are quite ready to work with the city to help make this happen, to provide our resources and our skills to be able to do this.
So this is Dr. Gowan. I just wanted to thank Dr. McCormick for dialing in. I wholeheartedly support what Dr. Rodriguez is suggesting, and I do want to say that I was around for the H1N1 that Dr. McCormick is talking about, and I saw firsthand the skill and efficiency with which they led us through that crisis. And as he said, this one is much worse. So I would wholeheartedly support what Dr. Rodriguez is suggesting.
And I would like to add that in looking what the Senate package or Senate is considering as a emergency package for aid, I think surveillance is going to be one of the things that is going to be reimbursed. So I applaud y'all for thinking ahead and tapping into resources that are probably going to be trickle down to the local communities.
Do you have any motions?
I just want to agree and echo the sentiment that Dr. Gowan is talking about. We are very grateful that we have these experts as a resource and leading us. And so often I hear, oh, well, how do you know about these things? Truthfully, I don't, but I have very good experts advising us. So we are very, very grateful for their leadership, and thank you for leading our city, Dr. McCormick. I would like to make the motion to approve.
Motion to
Second.
approve. A motion and a second. Any further discussion? Those in favor?
Aye.
Those opposed? Motion passes. Thank you.
Thank you.
Next we have agenda item number 4, consideration and action to amend the City of Brownsville Personnel Policy Manual to allow the establishment of a sick leave pool.
On this item, we'll allow Marina Solesi and Pedro Cepeda to present the concept of what we're proposing. I can answer any questions after they speak.
Mayor and Commissioners, in accordance with our organizational structure and our culture and values in support of our long-term continuity plans and our employees, we are requesting to amend our current personnel policy manual. Our current policy manual does not allow for the establishment of a sick leave pool. So requesting your consideration, this would create a 3-tier sick leave pool and bank structured as follows. 1 tier would be the executive positions, which would include city management directors and assistant directors. The other level would be middle management, which would include supervisors and managers. And then the other pool level would be the frontline labor force, which would include all labor and clerical positions. And so the city of Brownsville recognizes that there's a necessity to create a sick leave pool and bank to help cover employees who may need to utilize the sick leave because of current health issues, and then also in light of the COVID-19. Also to take in mind for those who cannot telework for those arrangements. We also have had our care team members who represent different departments who have done research on sick leave pools in neighboring communities. They've also done research on the statewide level. There's several state organizations that have sick leave pools, and also the federal government, and took best practices to formulate that. And as part of the care team, they also recommend the establishment of a sick leave. Currently, the Department of Labor is developing a pool for the employers who have less than 500 employees, so that would be the establishment of a sick leave bank. Unfortunately, because we have more than that number of employees, we wouldn't be able to qualify if that's approved. And so we would like to provide this tool and be flexible to provide that for our employees.
Okay.
I'll make the motion to approve.
We have a motion to approve. Do I have a second?
Second.
I have a motion and a second. Any further discussion?
How would it work exactly? So then each tier pulls all their sick leave in, and then it, as it's used, or how would it work exactly?
Yes, so as far as the tiers, it is a voluntary basis, and so if an individual, it's voluntary, if an individual would like to donate, they can go ahead and donate, but it has to be within that tier. So if it's middle management, it would need to be supervisors and managers. If they would like to donate, it goes into a pool. And if somebody needs to request it, it would have to be an FMLA qualifying event. And we are still working on the guidelines, but it would have to be tied to an FMLA qualifying event to be able to withdraw from the pool, from the bank.
Okay. Any other questions? Those in favor?
Aye.
Aye.
Those opposed? One opposition, Commissioner Neese? Commissioner Neese, are you opposed?
I said aye.
Oh, okay.
Yeah.
Okay, sorry. Motion passes, thank you.
Next, we have agenda item number 5, consideration and action to amend declaration of local state of disaster for public health emergency.
Is anyone presenting?
This item is being presented, Helen worked with the mayor, Art, also engaged Dr. McCormick on this item. So the mayor and Art and Helen can speak to this. I think Dr. McCormick could also provide his perspective, and then the commission certainly could chime in on the measures and what type of collective decision making y'all want to make on this item.
If I may briefly, as we saw yesterday, the county judge took some pretty strong and decisive measures that covers our county. The intent of our resolution or declaration is to kind of make sure that we covered everything that affects Brownsville based on our last order, which was issued a week ago. It expires today. It's prudent for us to extend that for another 2 weeks. And this was sent out, Helen, I believe, can say when it was sent out, but this should have been sent out to all the commission a couple hours ago when it was finalized for input and to see if there's anything else that needs to be added. For the most part, it's taking our previous order and either removing certain items that are no longer applicable because of the county judge's order, and making sure that we do have some other things that are applicable specifically to our city. So that should, Helen, do you want to discuss anything else?
As the mayor discussed, there are some measures that were eliminated because they were taken up by Cameron County. I will go through some of the changes that were made. Additional language was picked up due to Dallas County's measures that were adopted recently, and so we were just taking the best case scenario of different types of measures. For example, with the difference between the measures that were adopted on March 17th, we took out the occupancy. As you recall, previously we had an occupancy of 50% for restaurants and bars. That was eliminated with the Cameron County's measures because they are not allowed to congregate within restaurants any longer. Number 2, we maintained the second item measure that we had on March 17th, where restaurants and bars delivery and takeout is strongly encouraged. Downtown city metered parking will be immediately suspended in order to support these measures. Parking areas within shopping areas are strongly encouraged to create takeout and delivery designated parking spaces. And we also are allowing the metered parkings to maintain.
And as clarification also, Helen, on the restaurants and bars, because of the governor's orders as well as the county judge's orders, the restaurants shall permit delivery, pickup, and takeout only. It's no longer encouraged. That is the orders from the governor. So that got changed to only on hospitals, which is on page 1, it talks about all elective medical, surgical, and dental procedures are prohibited anywhere in the city. So that's for elective surgeries or procedures, and that's based on the Dallas order. We took that information from the Dallas order. Also on religious and worship services, that's going to be by video and teleconference. Any sort of in-person staff is limited to 10 people or less. And then Helen, did you cover daycares, both adult and child daycares?
Yes. Going back to the first one, so the restaurant shall permit delivery, pickup, and takeout only. Bingo establishments are closed, so that was the March 17th measure. That would stay the same. What was added, what the mayor just said, religious and worship services may only be provided by video and teleconference. Religious institutions must limit in-person staff to 10 people or less when preparing for or conducting video or teleconference services. And all individuals must follow the social distancing guidelines, including the 6-foot social distancing. This is similar to what Dallas County recently approved. The next one, all elective medical, instead of effective, it's elective. All elective medical, surgical, and dental procedures are prohibited anywhere in the city. Hospitals, ambulatory surgery centers, dental offices, and other medical services are directed to identify procedures that are deemed elective by assessing which procedures can be postponed or canceled based on patient risk, considering the emergency need for redirection of resources to COVID-19 response. That's also the same as what was recently adopted by Dallas County. Child care centers shall not have more than 10 children per room and comply with the 6-foot social distancing requirements as well as all state requirements. We understand that the state at this time has instituted additional requirements. Next one, adult daycare centers shall not have more than 10 adults per room and comply with the 6-foot social distancing requirement. We would add as well as adhere to state requirements. Next, all city libraries are closed. All City of Brownsville residents are strongly encouraged to use online services and drive-through services while doing business with the city. Brownsville bus service, B Metro, is continuing to implement social distancing. We have added no more than 10 individuals may ride a bus at one time. Next, the Brownsville South Powder Island Airport is limiting access into the terminal building to ticketed passengers only. That was the same as the March 17th measure. We have added all airport users are strongly encouraged to participate in the airport provided thermal scan, which is new. Next, city events are canceled until further notice. This is similar to the first measure that we were adopted, except in that measure we called it, we identified effectively on March 17th and we said until further notice, so this is just clarifying that. General public and private community events are canceled until further notice. Next, the City Commission will continue to meet remotely. We strongly encourage members of the public to watch proceedings on www.cob.us. So this is new that we've instituted given the situation. Next, in-person meetings of city advisory boards, commission, and bureaus are canceled. However, meetings may occur remotely. That's also with the new institution of remote meetings. Next, the city encourages members of the public to seek city services through the city's website or by telephone. Next, private events on city or private facilities are canceled until further notice. This is important. I'm going to repeat this one. Private events on city or private facilities are canceled until further notice. Fees and deposit of the facility rental will be refunded or applied for a rescheduled event. Next, the next measure is consistent with the state of Texas. any action for eviction to recover possession of residential property under Chapter 24 of the Texas Property Code and Rule 510 of the Texas Rules of Civil Procedure shall be in accordance with Texas Supreme Court order issued March 19, 2020, which states the following. No trial, hearing, or other proceeding may be conducted, and all deadlines are told until April 19, 2020. B. A writ of possession may issue, but the posting of the written warning required by 24.0061D1 of the Property Code and the execution of the writ of possession may not occur until after April 26, 2020, and the deadlines in Rules 510.8D1 through D2 are told while this order remains in effect. And C. New filings may be accepted, but the time period in Rule 510.4A10 is suspended, and issuance and service of citation may not occur until after April 19, 2020. Next, this is similar to the March 17th notice. The peace officers, City of Brownsville health inspectors, code enforcement / ordinance officers / inspectors, traffic specialists, and Brownsville fire marshal are hereby authorized to enforce this order. A violation of this order is a Class C misdemeanor punishable by a fine not to exceed $500 in accordance with the City of Brownsville Code of Ordinances, Chapter 1, Section 1.13, General Penalty. Unless otherwise stated, these measures shall be in place until April 7, 2020. Thank you.
So I would ask the city that when this is adopted or approved, that it be placed on the Facebook and all social media outlets immediately, because yesterday, when the counties was posted, I probably netted about over 100 questions asking about specific businesses and things like that that were going to be shut down or falling into that category. And the information took a while to pop up online. So I would just ask that the city be as transparent as possible and get this message out to everybody that they can. And city manager, if somebody has a question about, I'm having a wedding, I'm having a this, I'm having a that, my daughter, her birthday is tomorrow. Happy birthday, Abigail, I love you. And everything is completely canceled. That poor kid will be in her room all day long, which is really sad. But so many people have questions and things about their lives and how they're changing. Where can they call city manager? Who can they talk to if they can't find one of us on our social media outlets?
Mr. Bernal, you need to unmute.
I'm sorry. Sorry about that. I want to allow Mr. Romero to speak on this, just so that him and his staff can get some proper credit for the efforts that they're doing over at communications. So Felipe, can you please speak to how we're handling all communications and all questions?
Good afternoon, City Manager, Mayor, and Commission. This is Felipe Romero, Director of Communications and Marketing. We aggressively have launched several resources on our main page, on our page, that we update three times a day, and we also created the bpxcares.com website. As soon as the situation got progressively worse, we started to create this as a resources for the community to provide all the information that can be up to date, and also provide resources to the community in terms of accessing information on opportunities for business assistance, to reaching out to Texas Apartment Association for resources for rent. So there's several options that are out there in terms of getting the information, and we're actively pushing PSAs and information on our Facebook page as well to connect with the community and let them know the importance of, number one, the social distancing, and number two, where to get information in this kind of way.
This is Helen, Deputy City Manager, and Felipe, maybe you can give the mayor and commission some numbers that you have. I think you do have a substantial increase not only in Civic Alert, but BTX Cares. And so I think that would be good information to share with the commission and our viewers. I know you said there's 103 people watching us right now, and I think that's wonderful. With regard to facilities, we have been getting questions. Residents still can go to 546 Help if they do not have web or online access. We have ramped that up due to the number of COVID and other cases called, and we are dealing with it. We've received sometimes emails, and so we are responding as quickly as possible because we understand that some certain weddings or events are being postponed, and so we need to be cognizant of our families in Brownsville.
And so
To add to that, this is Felipe again. We've had on the main page, specifically on the COVID updates, over 22,000 page views, and that's as of 9 o'clock this morning. And then on the BTX Cares website, which just launched 3 days ago, we've already up to 14,000 page views.
Which is amazing, and I just want to commend the city for their outreach to the public, and just to remind the public that each one of us, the commission, city management, all city staff are here for you as a resource during these hard times with so many questions. Everything is changing day to day. Sometimes I get questions and I don't know the answers to because things change so fast, but we're here to answer your questions, and we're here to be with you. We will only make it through this together, so we have to stick together and just be here for each other. And if you need something, we are here for you. Just communicate to us, and we ask for your patience because this is a very crazy time, obviously, for all of us. I want to thank city staff for all of the things that they have been doing. You all have been doing an amazing job, and you all don't get credit enough. The entire emergency management team and our city management, I'm so proud to represent the city of Brownsville and to have you all by my side. So I just wanted to make that clear. Thanks.
I would like to echo all of that. I really like the BTX Cares. I think your staff is doing a great job in emergency management as well as that. And of course, our health department, who is outstanding at this time.
I agree.
Hey, y'all are doing a great job. Helen, are we going to discuss the testing tomorrow at some point, or when will that going to be discussed?
City manager, I don't know if you want me to take that question or
Well,
you want me.
Well, the suggestion, Mayor, that so as part of the measures that are here, one of the things that the commission can provide direction on is here we have items that are measures. There also could be items that the commission can express support for. I talked to our city attorney about that, and for example, if the commission when you put out your measures last week, one of the things you gave broad direction on, and then we worked this past week performing was the telework plan. So the commission, for example, could state that you all support, for example, proactive measures such as testing that staff look into for the community. I think that a broad statement from the community like that will be very beneficial, so the staff can work with the clarity that we understand the commission has that type of direction for us to be moving. That's just a suggestion.
Okay. Is there any other questions on this?
This is Dr. McCormick. Could I make a comment that may help people to give the population image of what we're dealing with? I think the head of WHO put it very well. We are fighting a fire blindfolded. We have transmission ongoing between people that we cannot detect, and the only way we can prevent that transmission is the kind of procedures that you are putting in place now. And that's the only thing that's going to prevent us looking like, for example, Spain, which I saw today, people lying in the hallways of hospitals coughing. We don't want to see that in our population. We don't have to. And I think these measures will go a long way to helping to mitigate that. So again, I applaud what you're doing and support it, because I know dealt with many outbreaks in the past in many parts of the world, what kind of panic can occur. I was associated with or investigated an outbreak of 150 of meningitis in Brazil, bacterial meningitis, which is about 20% mortality. And the level of panic across the country was pretty amazing. So I think this will go a long way in helping people, giving them comfort that the city and the county are doing everything they can to help not make that happen here.
Thank you, Dr. McCormick. Any other discussion from the commission? Any other?
I do, Ms. Mayor. I would like to say that we as a city are very, very blessed for many reasons. But I think many cities would give their right arm to have a school of public health amongst them at a time like this. And not just any school of public health, but one whose professors, like Dr. McCormick, had an entire career and life of working with epidemics across the globe. So we are very blessed to have them amongst us, and we're also very, it is very important to keep them in our corner and on our side and in our ears to listen to what they recommend. To that end, I hope that Art or you, Mr. Mayor, talk about the drive-through testing that will begin tomorrow, because one of the things that's very important that has really saved a lot of communities is mass testing for COVID-19, and I hope that you do talk about that, and I compliment you on your hard work to accomplish it, and would like commission direction and support to expand and develop that as we move forward into more testing and more testing.
Thank you, Commissioner. Further discussion from the commission?
I think it's important that we work with the county to clarify the order that was issued yesterday in terms of who can work and who can't. I know I've gotten probably 100 plus emails and calls from people that are afraid of going to work because they're going to get pulled over and either fined or arrested because they don't have a letter from their employer that's showing that they're working at an essential business or their job is essential to what's being done at their company. So I think it's important that we communicate to our citizens that what to expect and what they really need in terms of complying with this order.
Thank you, Commissioner. All right, do I have any motions on this item?
I'll make the motion to approve.
Do I have a motion to approve? Do I have a second?
Second.
Okay. But don't we want to talk about drive-through, or you can talk about it after the vote?
Well, for the purposes of this item, it's for the declaration itself, Commissioner, so I just want to make sure we get this passed.
Okay, no problem.
Which I would like, we can do so after this, but we have a motion and a second. Any further discussion? Those in favor?
Aye.
Aye.
Those opposed? Motion passes. Thank you. Dr. Rodriguez, and I'm going to ask council if it's allowed, but Dr. Rodriguez, can you give an update on the measures being taken that will start up tomorrow?
If I may, scope warning, we've already dealt with all the business that has been noticed.
So then, council, you're stating that we cannot give an update, so we should move to adjourn?
Right.
Okay, do I have a motion to adjourn?
If we could look that information on the, go ahead, Dr. Gowan. I think it's
I was going to say, Renee, Mr. DeClaus, is there a way to include it via public comment? Because it is important information.
We can't include it, but we need to notice it. If it would have been done during the portion of the public comment, which I believe no one signed up for, that would be perfectly okay. Unfortunately, I believe no one signed up and there's no one that offered any public comment at all. I believe that these things are important. I agree with you, Commissioner, but we need to be able to put it on the agenda, even if it's an hour before the meeting.
Then I would ask that Mr. Romero, in conjunction with Dr. Rodriguez, put out some sort of documentation on that. Okay, do I have any motion to adjourn?
So moved.
I'll make the motion to
Well,
adjourn.
any further discussion? Those in favor?
Aye.
Aye.
Bye, guys.
Aye. We stand adjourned. Thank you so much.
Thank you, guys.
Thank you for being here, everyone.
Thank you.